for the last 15 years. Yes, so I just, in February this year, I was diagnosed as having kidney failure. February this year, I was told by my doctor that my kidneys were not performing well. And it was from that point up to March, I was hospitalized back in my country. And in March, I was looking through the internet when I realized that there was a hospital in China which could cure disease without having to go through donors to this country. Before coming over here, I was hospitalized a couple of times because of the situation I was in. I was very sick, very weak, shortness of breath, heart failure. Yes, so many. I went through a lot of trouble. I lost all the weight that I had gained. I was 60 kilo at the time. And then I went down to 55 kilo. Yeah. But again, there were medications given just to put me off from those other pains that I was going through. But I managed to get through and to be on my feet again.
So how many pounds are you right now?
I'm 56 at the moment. It goes up and down. So I had, I was on the dialysis, and I think apart from the other normal treatments that I had, I was on the dialysis, I should say. That's the most important because it was really relating to the kidneys. So the dialysis was sort of a relief, when I was having it, going through it.
My name is Raka Itana. Seated next to me is my wife, Josephine Itana. And further down is my mother-in-law. My wife is a patient, so she will briefly talk on her medical stuff. But I want to put on record that my wife is the first Papua New Guinean to come to this. In fact, three of us for the first time into this hospital. So I think it's a great stuff to be here. Papua New Guinea is up north of close to Australia, and it's probably the biggest island in the South Pacific region. And our existence here is actually first time in coming to this hospital.
When I was going through the internet, I found out about this hospital. I was very desperate to come here. So I told my husband and my family members, my brothers, sisters, and my uncles and aunties to assist with my coming over. And they sort of assisted that with finance. And here we are today in this hospital. Yes, they've been very helpful. They've been praying about, every day there's people praying about me and my mom and my husband and myself. Since the day we departed, we've been praying and about, to recover and to get the useful medication from here. So I get the emotional, I get the feeling that my family back home are always praying for me. That's why I'm getting stronger, and also the medication is helping me a lot. Well, in a sense, yes, it is. The family support is very, very necessary in such cases like mine, when you're in a desperate need to get well, and also when you're far away from home, you really need your family support to back you up, to give you that moral support to be on your feet. Instruments, I should say, the technology to cure kidney diseases. It's very hard. We have to be out of the country, either to go to Australia, Singapore, Manila, or China for such cases like that. My country is a developing country, And we only have, within the country there, I think 2 hospitals which have dialysis machines. So it's very, very hard to treat the kidney problem back in my country. While I was hospitalized back in my country, I was looking through the internet, and I happened to find this hospital in China. And when I saw that they go through stem cells and all, although I don't know much about stem cells, and Chinese, in my thinking, they deal with herbs. I love taking herbs. Yeah. So when I saw that this was a kind of hospital that dealt with the herbs, and I was more than prepared to come here. It was through the internet that I came to know this hospital. Herbs that have been made in America and in Australia, sent over to Papua New Guinea, to my country, and I buy them from the shops.
Here?
I saw a Kapancha in Cairns,
Australia.
Cairns in Australia, and he's specialized in Chinese herbs. And I didn't get his views as to whether I should come here, but I myself made a decision to come to China. I am the first Papua New Guinea to have stem cell treatment here. The first Papua New Guinea. Our patients go through Singapore to do kidney checkup and all that, kidney transplant in Singapore, the only hospital, in Manila.
Never.
But in China, I'm the first person to come here.
When she was diagnosed with a kidney failure, there were 2 options. Number 1 being kidney transplant, which was supposed to be conducted in Manila. The other option, and again on the advice from our local practitioner, was to get here. Stem cell, never heard of it in my entire life. And its progress, how it has helped a lot of people through my wife, who were able to access to the internet, collated all the information, and that's how we got here. In fact, our local practitioner, the doctor, also suggests that we come here instead of traveling to Manila for the transplant. Donor, the difficulty was donor. Whether we want to pick up the right donor or a wrong donor, I mean, something that...
When I first arrived here, I was very weak, tired. I lost weight, and the nurses and doctors will say how I looked when I first arrived here. I've sort of gained some weight on my face. Yeah. But after the first stem cell, I felt so energetic, I felt as though I was back as a 16-year-old or 7. Mind you, I'm 52 years old. And when I had that stem cell for the first time last week, I felt very energetic. And up to now, I feel so strong, much, much better than when I first arrived here. Losing a bit of my eyesight too, but I think I'm getting the eyesight back again. Yeah. I would say the service provided here is very, very good. The nurses are very, very helpful, the doctors. Although the doctors don't speak much English, we communicate with the nurses and the translators. They're very good. They help us out. And there's always 24-hour service at our side. With people outside, I don't know them, It's very hard to communicate with them. The only people I can talk to are the nurses and the translators in this floor. Well, yeah, before the treatment, like I said, the doctor, although he speaks or understands a little of the English words, the translator is always beside him. So whatever treatment plan was given, she was always explaining as to what was taking place before, what I was going to do, and afterwards. So more or less, I understood what was going to take place and what was going to happen.
Right from the very start, I must say, it was perfectly organized. All right. The only problem, in fact, when my wife got onto the internet, and then about 20 minutes later, I was still at my home when someone from here called, Marina, and that's how we started communicating, and from there, that's how we developed that relationship, and right up to the airport to here, was perfectly all right. Yeah. I think that for me, I actually went out of the hospital, so that at least there was some breathing space there for me. But I think for my wife and my mother-in-law, I had to stay here full time. So that's their opinion. Whatever they want to say, that's.
With my bit, I would say thank you to Josephine's nurse, Linda. She's been so helpful, as well as the other nurses too. But Linda is responsible for, or Lydia is responsible for Josephine. So with communication, bit of communication, we sort of send a lot to get something from the canteen for Josephine. Thank you.